If you are a female and you're experiencing hair loss, I understand that this could be very distressing. But I promise you, you are not alone. In fact, it's very common for women to lose hair. And the misconception is that men are the only ones losing hair. This is simply not true. In fact, close to 50% of women before the age of 50 experience some level of hair loss. So let's discuss common reasons why women lose hair and the best treatment options to explore if you are a female to address your hair loss. Before we jump in, I just want to point out that female hair loss conditions is a massive topic to cover, but I promise you I'm going to do my best. Now, as a hair surgeon and as someone who's a hair loss expert, my responsibility when I see a patient is to first identify the type of hair loss that they're experiencing. Now, the term alopecia is a broad umbrella term to describe hair loss conditions, and alopecia is really bucketed into three different terms. Non-scarring alopecias, which are the most common form of hair loss. Scarring alopecias, where you have non-viable hair follicles that once they fall out, it's left with a scar. They're very hard to treat these conditions. And then you have hair shaft abnormalities. What we're going to do today is really focus on non-scarring alopecias because those are the most common forms of hair loss, likely the type of hair loss that you're experiencing. And then we're going to discuss the treatment options that are viable that help to address these conditions so you can address your hair loss starting today. So hair loss can present in two different ways. I commonly either see it as hair shedding or a decrease in density. Now, hair shedding can be you're combing your hair and you're starting to notice, wow, there's a lot of hair in that comb. Or you go in the shower and you see a clump of hair in the drain and you're like, wow, that's not normal. Now, it is normal for us to lose up to 100 hairs on a daily basis. But if you start to lose more, well, maybe you have a hair shedding condition. And then if you have decrease in density, well, that's another presentation for hair loss, and that might present as a widening part. We use the Ludwig scale to kind of determine the severity of density loss, but you also might have patches of hair throughout, and it's kind of dispersed. And it's also possible that your ponytail is not as dense as it used to be. If you're someone who is experiencing hair shedding, you tend to notice this pretty rapidly because you know it's abnormal. Whereas with hair density, it's more of a gradual change and usually it takes up to 50% loss of hair in that region to say, hey, look, I have a hair loss condition and I need to take care of this. So these are really the two presentations that I commonly see when patients say, hey, I'm experiencing hair loss. So the next thing we have to figure out is what is causing your hair loss? And this is a very challenging one to figure out sometimes. The top of my list would be genetics, and that's the most common form of why we have hair loss. Hair loss is polygenetic. It can come from your mother or your father. But there could also be hormonal imbalances. There can be an underlying medical condition like a thyroid condition. Also, the way you style your hair, whether you put your hair into tight braids, can be a contributor for why you're losing hair. And nutritional deficiencies is certainly up on that list. And last and foremost is stress. Stress can cause your hair to fall out. So these are things that we have to really consider when we're trying to identify what is the root cause for why you're experiencing your hair loss. I hope that I'm helping you to really understand the root cause of your hair loss. I would love if you could support our channel by hitting the subscribe button. The first hair loss condition we're going to discuss is androgenetic alopecia, also known as female pattern baldness. And this is the most common form of hair loss. It's caused by genetics. Genetics either from your mother or your father or both. Now, what happens during androgenetic alopecia? Men tend to lose all of their hair, but women have a widening part. And so that's really the way to identify whether you have androgenetic alopecia. What's happening under the hood? Well, women have a small level of testosterone, and when that testosterone gets converted to another hormone known as DHT, dihydrotestosterone, some of the hair follicles on a female's hair will be more sensitive if you have androgenetic alopecia to DHT, and DHT is a major contributor for why you're experiencing hair loss. That's an important point to point out because later on in the video, we're going to talk about specific treatment options that you can use to treat this condition. The next hair loss condition we're going to explore is telogen effluvium, and this is excessive hair shedding. This can be very emotional because this can go on for many, many months. But there's hope because this condition usually is an acute hair loss condition. It usually only lasts up to 6 months. And it occurs because of some stressful moment that happened about 3 months before. It could have been from being sick. It could have been from an emotional breakup. It could be from a medical condition, maybe like a thyroid condition that caused it. It could also be because you just delivered a child or you're breastfeeding. So this has to be factored into determining exactly what the root cause of your telogen effluvium is. But the good part is that most cases, a majority of cases, and basically every case that I've ever seen of telogen effluvium has resolved completely on its own. When you lose your hair from telogen effluvium, you're not losing the seeds, and that's a very important distinction to make. The seeds are what allows new hair to grow. So when you're in a telogen effluvium state, I call it, that means more of your hair is in the shedding phase than in the growing phase, okay? And so now, once the shedding has subsided and calmed down, your hair can take anywhere from 6 months to a year to regrow. So you have to be patient. But we're going to explore different treatment options that you can use to accelerate hair growth after the telogen effluvium has kind of calmed down and subsided. The next hair loss condition we have to talk about is traction alopecia. And this is when you wear your hair in very tight styles. Okay, so if you're someone who likes to wear ponytails, braiding your hair, if you put your hair in a weave or cornrows, if you wear hair extensions, all of these things are causing tension on the hair follicles. So my recommendation is if you're starting to see any hair loss in your temples as a female, okay, up here, start loosening the styles of how you're wearing your hair because you're causing damage. And once the hair follicles fall out, they can't be replaced easily with medication. So early intervention is key when it comes to traction alopecia. Another factor that's important to discuss is hormonal changes. Now, if you're taking a first or second generation birth control, that birth control might mean you have higher levels of androgens in your bloodstream, and that can be contributing to hair loss. Now, if you're someone who has PCOS, polycystic ovarian syndrome, that also means you might have high levels of androgens in your bloodstream, and then again can contribute to hair loss. Now, if you're postmenopausal, what happens is your estrogen levels went for a nosedive, and estrogen has a protective mechanism to prevent hair loss. When you lose the estrogen, testosterone takes over, and testosterone could be the reason why you're experiencing hair loss. 3 medical hair loss conditions that I think you should be aware of are alopecia areata, which is an autoimmune hair loss condition where our own body attacks our hair follicles. You can be left with these coin-shaped areas of hair loss. Then there's trichotillomania, which is excessive pulling of your hair follicles. Okay, and this is common actually to see in women. It's usually associated with mental health. And so the underlying issue needs to be addressed. The third medical condition that I would like to point out is FFA, frontal fibrosing alopecia. And this can be seen in postmenopausal women where the hairline is extended backwards and you have significant thinning and hair loss of the eyebrows. The last thing we're going to consider is whether you have an underlying medical condition or a nutritional deficiency. So, do you have low zinc levels? Do you have low iron levels? Do you have low vitamin D levels? Are you hyperthyroid? Are you hypothyroid? Do you have diabetes or do you have lupus? These all need to be considered and they all need to be ruled out. So now let's discuss treatment options for your hair loss because there's a lot of options out there. First and foremost, having a blood test is very important because it helps us rule out any of those nutritional deficiencies we discussed or those underlying medical conditions. The underlying medical conditions can be treated with the appropriate medications to help resolve some of the issues that you're having with your hair loss. If you have nutritional deficiencies, you can supplement that with vitamins and, of course, changing your diet. So now it's time to talk about hair loss medications that are really effective at stimulating hair growth for females. And I want to emphasize something. When you start taking hair loss medications, it's a lifelong commitment. You really have to be on these medications to preserve your hair. The only time that I recommend stopping is if you're thinking about getting pregnant, you're currently pregnant, or you're breastfeeding. Now, where do you start? With men's Rogaine. Yes, men's Rogaine, not women's Rogaine. Why? There's no difference, okay? And specifically, I want you to purchase 5% men's Rogaine foam. It's less irritating to the scalp. The reason why there's a female version of this is because of the pink tax, and that's only to charge you more. It's the exact same product. Now, on this bottle, it does say apply twice a day, but it's not necessary. You could apply this once or twice a day, but my preference is to apply it once a day. I specifically apply it in the evening time, but you can apply it in the morning time. Now, there's also an option to take oral minoxidil, and this is a pill that you take every single day, and that also is very effective at helping to stimulate new hair growth. Spironolactone is another popular oral medication that I put a lot of premenopausal women on because it's very effective at lowering androgen levels in the body as well as preventing the hormone DHT, which is a major contributor to hair loss, from binding to the androgen receptors. So minoxidil and spironolactone are very safe for women before they get pregnant. After you're done having kids, then I would consider putting you on DHT blockers, so finasteride and dutasteride. These medications are not safe if you're thinking about getting pregnant or you're currently pregnant, but they're absolutely safe and they're very effective in women after you're done having children. And they work by blocking an enzyme called 5-alpha reductase. And when you block that enzyme, you decrease the amount of floating DHT. And as we've discussed multiple times on this video, DHT is a major contributor to hair loss. Now, if you're someone who does not want to use hair loss medications, or you're trying to get pregnant, you're currently pregnant, or you're breastfeeding, there are luckily natural organic options for you to explore. I really like these natural DHT blockers: rosemary oil, saw palmetto supplements, ketoconazole shampoo, specifically 2%. If you apply it to your scalp on a regular basis, this can be very effective if you do it 2 or 3 times a week to help improve scalp health, as well as potentially act as a natural DHT blocker. And then you have pumpkin seed oil. Now, there's also the option of doing what's called red light therapy. Now, these helmets could be quite expensive, but if you do this on a routine basis, they can be effective. Now it's time to talk about in-office procedures to address your hair loss. The two that I really love are PRP and mesotherapy. Now, I made an entire video detailing the breakdown of the two of these, but to give you a quick overview, PRP is platelet-rich plasma. We take blood from you, we spin it down, we isolate the growth factors from the PRP, and we inject them back into the scalp. This is a very, very safe procedure for women, and you can do this if you are pregnant. With mesotherapy, it's the same concept, except we don't use your blood. We use either medications, vitamins, or minerals, and we inject those with microneedles across the scalp. I would be cautious if you are pregnant because we can't inject dutasteride, finasteride, or minoxidil. We can inject vitamins or minerals into the scalp. So when you're pregnant, I would lean towards using PRP, but if you weren't pregnant, I would say mesotherapy would be my first option. And the last option to address your hair loss is with a hair transplant. Yes, females do get hair transplants as well, but it's vitally important that you're either on medical therapy or some form of organic hair loss therapy as well when you get that hair transplant, because that's how you get the best results. So that's a wrap. We covered a tremendous amount of material. We talked about the reasons why you might be experiencing hair loss and the treatment options that are ideal for women. So if you have any questions, please leave them below. And as always, I'm here on this journey to help you address your hair loss.